Good afternoon to everybody. My name is Emiliano Ferrari, and I'm here to spend with you 1 hour talking about this new prosthetical concept, which is called Easy Fix. First of all, we can spend a few words about the heart of this prosthetical system, that is the OT equator abutment. For those who doesn't know what the abutment is, this kind of abutment, OT equator is particular for his versatility because it's a kind of abutment that can be used for implant retained rehabilitation, so for overdenture, for passive bar connection, and for fixed rehabilitation. Everything with the same abutment. So that's a very important thing because it's really interesting for our daily practice use an abutment who can be useful for a lot of different treatment plane or different solution inside the same treatment plane. First of all, we talk about implant retained overdenture. So we talk about rehabilitation with implant retention and soft tissue substantion. And it's in this situation, we use the external part of the equator. So at the same way we use a sphere. The very interesting characteristic of the equator is the dimension, because we are talking about a low profile attachment who give you the option to save a lot of prosthetical space. And that's very important in this kind of rehabilitation because we can maintain the same retentive area, so the same performance of a sphere, but saving a lot of prosthetical space. There's the option to have the correction of very important divergency until 50 degrees using the same abutment, just changing the female, so using the smart box. And that's the first option. We can use it on natural remaining teeth, so using a natural root, or implant if we don't have enough natural remaining teeth. Second option is the construction of a bar with a really passive kind of connection. So we can screw our bar on the equator and we can realize those bars in a really passive way. So very easy to be realized from the lab and very easy to be used for the clinical during the delivery of the prosthetic rehabilitation. And at the end, screw retained fixed rehabilitation. That's the first step of fixed rehabilitation with OT equator. We use the OT equator as a multi-unit abutment, and we can have a lot of benefit respect the use of the multi-unit abutment related with the structure, the strongness, the dimension of this abutment respect the classic MUA. I say it's the first step because today we will talk about the second step. Second step is fixed rehabilitation without all the hole that you can see in this rehabilitation. So this is a kind of very functional rehabilitation, so an OT bridge with a screw on every single implant. The same way we use the multi-unit abutment. For those of you who know these systematics, you know that sometimes we can avoid the use of some screw because the connection between the equator and the prosthesis is given both by a screw and a Seeger, who is an interrupted sync ring who give connection between the equator and the prosthesis. And in some situation, it's enough, the Seeger, without the screw. So a certain number of screw and a certain number of implant who are used in a blind way. But today we talk about something really, really different. We talk about fixed rehabilitation without screw. It means a fixed connection between the equator and our fixed rehabilitation, but without any screw. And what are the benefits? We got a lot of benefit. First of all, the absence of prosthetical screw and a prosthetical seal that it's the same of the standard T-based system. We have an easy control of the retention. We have the option to an traumatic removal system thanks to a particular unlocking tool. We can correct divergence until 60 degrees. And of course, we got the option to have easy hygiene time because it's very fast and very easy to remove this rehabilitation. So let's see every single benefit in deep. The absence of prosthetic screw is the secret because on that way we can maintain the integrity of the occlusal surfaces, and the only hole we need is the one to use the unlocking tool. For that reason, you see in the occlusal view of the rehabilitation a hole with a screw, but the reason for this hole is just to use the unlocking screw. The seal is comparable to the standard T-base. Because of the precision of the mathematics of the system, you don't have to be scared about the precision of the connection between the first and the secondary abutment. We have an easy control of the retention because are available different kind of Seeger, starting from the stronger, arriving to the softer. And you can choose the strongness of the Seeger depending in relationship with the kind of project, the number of implant, the divergence of the implant. So you can move and change the kind of retention, moving or changing the color of the Seeger. And that's very important because our idea is to use the stronger Seeger as possible. Okay, the stronger that it's easy, that it's possible to be inserted. We can remove this kind of rehabilitation only using the unlocking tool. So the connection is so strong that it's impossible to remove is freehand. You have to use this unlocking tool. So you have to choose during the project of your rehabilitation the correct position to use the unlocking tool. Correct position means taking care about aesthetic, about dimension, about the position for the clinician. So you can choose, taking a look on all the implant you have used, you can choose the one it's easier and in the best aesthetical position to be involved in the use of the unlocking tool. And the remotion with the unlocking tool is very aromatics because it works very easy, as you can see in this video. There's a dedicated screw who arrived to the head of the equator and move to the top the single connection between equator and T-base. And that's enough to remove all the rehabilitation because you create, on this way, you create a space and you create the option to remove very easy the rehabilitation. There's the option to correct divergence until 60 degrees. And the more your implant are divergent, the more you have stability. Of course, you have to choose correct color and correct performance of every single Seeger depending on the project of the rehabilitation. At the end, of course, we have a very easy kind of hygiene because it's very fast to remove just using the unlocking tool, very fast to be removed and very fast to be inserted. And that's very important because when we realize those kind of prosthetical project, usually we check our patient 1, 2, 3 times a year, and we lose a lot of time for unscrewing the Toronto Bridge kind of rehabilitation. On that way, you can save a lot of time, and it's very easy to be done, both from the clinician or for the hygienist. Okay? So that's a little video who show the single hole that it's used for the unlocking tool, like you can see here. We choose and we move the Seeger used for the realization in lab, so the black Seeger who are just dedicated for the lab step. We move and we change, choosing the correct color respect our kind of project. After the insertion of the Seeger, we have got an instrument to check the perfect fitting. So this part of the insertion instrument, it's of the dimension of the equator and give us the feeling of the connection between our OT equator and the Seeger. After that, we choose the correct axis of insertion and we use the screw to fix just because we have an available hole. But I remember that the hole is dedicated for the unlocking tool. We got a hole, we use a screw. But the idea is that we don't need a screw to fix this kind of rehabilitation. So we intend this as a new frontier for the full arch rehabilitation because it's something really, really new. And if we have a step back just to understand what are the benefits of this kind of rehabilitation, we have to understand that the connection between abutment and our prosthetical project can be different, can be cemented solution, we can have cemented solution, screwed solution, or conometry. And now we got easy fix. What are the benefits and the disadvantages of every single solution? When we talk about cemented rehabilitation, you know that the benefits are aesthetical one and all the benefits related with the integrity of the occlusal contact. So resistancy, aesthetic, and we can correct every disparallelism. And of course, passivity given to the presence of the cement. But other side, the disadvantages are related with the presence of the cement. So difficult in cement removal, loosening of the screw of our abutment cemented with the rehabilitation, and of course, difficult way of remove and difficult way of inspection. At the other side, we got screw retained rehabilitation. And in this case, the benefits are related with the absence of cements, the easy way to be removed. And of course, that we need little prosthetical space to be realized. But the disadvantages are related with the loss of integrity of the occlusal surface. So we have problem in aesthetic for the position of the hole, and we can have stress of the screw in case of not perfect passivity. Of course, the very important problem are the long time for inspection, for long time to remove and to screw during hygiene, and during correction, and during check, everything. So long time of inspection. When we talk about easy fix, you have to intend a kind of rehabilitation with the benefit of the cemented and the screw retained rehabilitation, because we maintain the integrity of the occlusal surfaces with aesthetical and functional benefit, but we also have the benefit related with the absence of cements. So we have aesthetical benefit, more resistance for our manufacturer because of the integrity of the occlusal contact. We don't have problem with the cement, and we have rehabilitation who is easy to be removed and who give us short inspection time. So we are talking about a kind of rehabilitation who who give us all the benefit of the cemented and the screwed one. Okay? So, to better explain the systematic, I have chosen three clinical cases to share with you of different difficulties. So, starting from the remaking of a pre-existing prosthetical project and passing for a delayed loading rehabilitation, at the end, an immediate loading rehabilitation, just to explore all the options that we have in prosthetical project. The first case, the pre-existing prosthetic project remaking, is the case of a patient with a hold rehabilitation on bar. Now she want to change the rehabilitation for aesthetical reason and because the project is so old, so she got a problem for the damaging of the rehabilitation. And she wanna try to understand if it's possible to go with a fixed rehabilitation because she got a problem of gum smile, and that the reason because the first project was on bar, but now we want to check if the change in the aspect of the patient give us now after 10-15 years the option to move from a removable to a fixed rehabilitation. So we take impression, picture, and also a face scan just to study a new project. And we start from this design of the rehabilitation to a change of length of the teeth. So we want to move the smile line, changing the dimension and the relationship between the upper and the lower, and between the dimension of the upper and the lower teeth. So we try in digital way to change the shape and the dimension of the teeth, and we do a new project for the occlusal contact and from the aesthetics. First of all, we print an acrylic aesthetic test just to go in mouth, first of all, to see the aesthetical results. And that's what we imagine with our project in the face scan and changing from the starting situation to the new project. Now we want to see in mouth the results, and as you can see, the results is the same of the project. So very interesting solution because now we know that we can move from removable to fixed rehabilitation. There is no problem of gum smile, no problem with the subtension of the upper lips. So that's an available solution. Okay, and you can see better in the video respect the idea you can have looking just a picture. So now that's our design of the final project. First of all, we take an analogic impression of the soft tissue, and we realize the analogic model for the position of the implant and for the profile of the soft tissue. Now, on this master model, we start to realize our project of EasyFix. That's an really old case. It's maybe the first case we have realized something like 2.5 years ago. So at that time, we didn't have the mathematics to realize that. And we have worked in mixed digital and analogic way. So in the analogic master model, we have screw the EasyFix abutment, and we took a scan of the master model, so we can move from analogic to digital world. And in digital world, we have realized the project of our provisional. Why provisional? Because before to realize the fixed final rehabilitation, we want to try the phonetic of the patient. who move from a removable to a fixed rehabilitation. During the check of the aesthetic, we also do a check of the precision of our intraoral scan, because we took the position, the impression of the position of the implant with an intraoral scan, and we want to check the precision of the master model with this plaster control key. So we go in mouth, we have no problem with the plaster control key, so we know that our impression was good, and we can work on this position of the implant to the project. The project is done by two parts, so a metal structure and an aesthetic parts who have to be bonded to the metal structure. The realization of the metal structure is on laser melting, so this is the bar, and here you can appreciate the perfect seal between the easy fix abutment and the OT equator. This kind of seal is what we pretend to have on the master model and in mouth too. That's the aesthetical part who must be bonded to the metal. And here you have the complex. So the aesthetical parts, the white one, the metal structure, and all the easy fix abutment that must be bonded inside the metal structure. For that reason, you can preserve passivity bonding the abutment inside the laser melting structure. And here you can see on the model how the unlocking tool works. In this case, this is an old case, so the unlocking system was composed by two different components. The usual tool of Rain 83 to screw and a screw. But nowadays we have an instrument, just one piece instrument, who work same way. So what you see in this picture is the same things you can see nowadays with the new unlocking tool. As you can see, when the screw is inserted and when we start to screw, we have the moving of the connection and the detachment between the equator and our prosthesis. That's enough to remove by your finger all the prosthesis. Okay? It's very important to choose the position, and there's different reason to choose one position respect another one, and we will see this reason during this lecture. But what is important is the use of the correct Seeger. As I told you, this is an old case, so we are trying different strongness of the Seeger. You don't have to take care about the color because this was an experimental situation. Nowadays, we have codified code who are pink, yellow, and white for the different strongness of the Seeger. But here you can see that we have done a mix of color, so a mix of strongness because of the reason of this prosthetical project. And that's the provisional in mouth, who respect the aspect of our digital project, our printed test, and that's the provisional. So when we are happy about the provisional, we wait a little time just to be sure about the phonetical situation of the patient. And now we are ready, after the healing of the soft tissue and everything, we are ready to go with the final project. And what you can see here in the provisional is just one screw, or better, just one hole. The screw is used just because we have the hole, okay? But we don't need screw for the stability of the EasyFix component. Here you can see the final project, little change between the provisional and the final rehabilitation in a little portion, just a little changing of the shape. And the final project, the design of the metal structure. The design of the metal structure depends on the kind of material you choose for your rehabilitation. But of course, it depends on the final volume of the rehabilitation. So first of all, when you want to design the metal structure, you have to take care about the final volume. So first of all, you have to design the final volume of the rehabilitation. And now in digital way, for with subtraction way of working, you can design the metal structure. In this case, the final rehabilitation will be metal composite with injected composite. So we need strong metal structure with element of retention for our composite. And that's the design you can see in the project. This is the aspect of our structure immediately after the laser melting. So you can see that must be polished, and you can appreciate the precision of the connection in which we have to bond the easy fix abutment. That's a picture who show the insertion of the Seeger. The black one, I remember you, are the Seeger dedicated for the lab step. Okay, so during the step of realization in lab, your technician have to use the black Seeger, but the insertion is in the same way the insertion of the final Seeger, so with a dedicated instrument. And here you can see that it works by pressure, very easy, impossible to do mistake in this step of the rehabilitation. Now we are ready for the aesthetic finalization. So by injection of the composite, two different injection, one for the dentin, one for the enamel. So that's not important. The important thing is that working with easy fix system give you the option to doesn't change nothing in the lab step. You can choose the kind of material you prefer. You can choose the digital or analogic way. It doesn't change nothing. For the prosthetical step, doesn't change nothing. You can choose and work the way you prefer. The only things that change, it's a benefit. So you don't have a hole for the screw, just one to use the unlocking tool. But on that way, you can maintain the integrity of the occlusal surface with all the benefit related with the integrity. So aesthetical one, of resistance, the integrity of the occlusal contact, so benefit in the chewing, so all the benefit related with the absence of prosthetical, of the hole for the prosthetical screw. And here you can see another time in a picture how the unlocking tool work. The insertion, screwing, and the detachment between the equator and your rehabilitation. And here we are ready to deliver the final rehabilitation, just choosing the correct color, so the correct strongness of the Seeger. And I repeat, the color and the strongness of the Seeger depends on the number, direction, and position of your implant. Another interesting things is that are available some sealing screw. Those sealing screw are useful to fill the space inside your equator, because you know that the equator, it's an abutment who can be used for the aesthetical surface, as we do in direct overdenture, or in this case for easy fix, but can be also used to screw something, a bar or a fixed rehabilitation. In this case, we don't need to screw nothing on our equator, excepted one. So all the equator who are not involved in the use of the unlocking tool can be sealed with this sealing screw. That's to maintain hygiene and to don't leave a space for plaque or bacteria on all that situation who can give inflammation of the soft tissue. For that reason, that they imagine an occlusal vision of the lower and upper jaw, and you can see that all the equator who are not involved in the use of the unlocking screw, system of the unlocking tool, are sealed by this screw. And we leave free just two equators, one for the lower jaw, one for the upper jaw. And those equators who are left free are the one that we will use to insert our unlocking system. Okay, so you can have 4, 5, 6 or more implant, and you can maintain the integrity of your occlusal surface, just leaving the space for one hole. And that's the final result. So interesting aesthetical final result, starting from an hopeful removable solution for our patients. Second step is move to a fixed solution, starting from a fixed solution. It's a case of delayed loading, a patient who have to rehabilitate the upper jaw, and starting from this situation, so we have to remove a lot of hopeless teeth and also an impacted canine in the upper jaw. So for that reason, we consider that it was difficult to go with immediate loading after post-extractive surgery. And we prefer to do two steps. First of all the extraction surgery and the delivery of a removable solution, waiting for the healing of the soft tissue and immediate loading. So first of all, we prepare a pre-extractive provisional, and we deliver that provisional after the extraction of the impacted canine. And now we wait for the healing of the soft tissue and the hard tissue to go with the second surgery time. But now we also have the time to study the aesthetic and the function of the provisional, and to realize a new design of the teeth, so to changing the shape of our project. And with this changed project, we can also design our surgery. Because first of all, we print a new aesthetical test. We check in mouth if we are happy about this changing from the removable provisional. And when we are happy, we can use it to design our surgery guided from the computer. So you know that when you work with this kind of surgery, you need two kind of file. STL file for the value of your rehabilitation and DICOM file for the available bone. Now we have all the information to choose type, position, and direction of our implant in function of the prosthetical project. On that way, we can design a digital surgery guide and a provisional. And the day of the surgery, we arrived with a good provisional reinforced by a strong metal structure and our surgery guide. So the surgery is very easy, flapless in this case, few minutes to put 5 implants and our equator. And we can deliver the provisional. In this case, the provisional is an OTB concept. So the first step of fixed rehabilitation by RAIN 83 system. It means fixed rehabilitation screwed on all the OT equator. Okay, something that worked very well, something that we use till 15 years in our daily practice. When we are happy about that, we wait for the healing, 3 months, healing of the implant, so at the end of the osseointegration, and now we are ready for the final rehabilitation. Also in this case, we choose Easy Fix as final rehabilitation. So what we have done, take an intraoral scan of the position of the implant, an intraoral scan of the provisional, and with those information, we change another time the aesthetic. So we can try, we try to do little aesthetical change in the design of the teeth. So we realized a new project, and we go in mouth to check the new problem, the new project. And at the same time, to check the precision of our intraoral scan. As you can see here, we got the mathematics for Easy Fix abutment because it's a more recent clinical case respect the first one. Nowadays, you can work, if you work in digital way, you can work with this mathematics and do your project taking care about the available space. So we design the aesthetic test, we print it, and we go in mouth with a plaster control key to check the precision of our impression. In this case, we got a little mistake, so we have to correct the position of our implant, and that's very easy to be done using this plaster control key. That's the aesthetical trying, the printing aesthetic test. We are happy about the moving in first class of our incisor, and for that reason, we can transform that project in the final project. As usual, the design of the metal structure must be done after the design of the final rehabilitation, so for subtraction. In this case, we have choose different material for the rehabilitation, or not. Same material, metal and composite, but not injected composite, printed composite. For that reason, we don't need the retention in our metal structure. We need to leave much more space for the resistance of the composite. And here in the project, in the section of the project, you can see the design of our bar. So smooth bar without element of retention, with a lot of space for the aesthetical parts, just to have much resistance, much strongness in the composite parts. But the project workflow doesn't change. We have also the same step of realization, just in this case, change just the project of the metal structure. This is the metal frame, as usual, realized in laser melting, and that's the aesthetical part in printed composite, who must be bonded with the metal and characterized for the aesthetic. And here you can see, as usual, the unlooking tool. We choose one hole and we check on the master model if it works good to unlock our rehabilitation. And that's the finalization, so aesthetical finalization of this composite. Also in this case, as you can see, the sealing of all the equator who are not involved in the use of the unlocking tool. We leave free just one equator, who must be used to unlock our rehabilitation. Okay? And that's in mouth how apparent, how it's easy to use the unlocking tool. That's the final results. So this case, it's a little bit more difficult respective. First, because we have to wait for the osseointegration of the implant and we have to check for the project, but something that it's daily usual to be realized. Last case is something a little bit more difficult or a little bit more particular because we are talking about immediate loading, all realized with this standard of technique, so with the easy fix. Let's do a step back. That's a case that began 6 years ago. That was the situation with a provision in the upper jaw and a whole denture in the lower jaw. The desire of the patient was, in 6 years ago, fixed teeth in the lower jaw. So we go with a Toronto bridge. But we have to correct the line. So at the same time of the delivery of the lower fixed rehabilitation, we delivered a new provisional in the upper jaw, just to have correct line for the final rehabilitation, starting from the project to the delivery. And that's the final results 6 years ago. Now, after 6 years, patient one fixed tooth also in the upper jaw. So we have to remove hopeless teeth because right now the situation of the teeth are not the same of 6 years ago, and we have a provisional who show a problem related with the time and soft tissue contraction with the exposition of recession and something like that. And the interesting things is that we have done an intraoral scan of the provisional, and in comparison with the project of 6 years ago, we have a fantastic results. It's the same. So nothing changed in 6 years of using of this provisional. And that's very interesting because it means that working digital workflow give us the option to check the progression of our manufacture during the time. But it doesn't matter. What matters is that we use our project, our old project of the upper jaw, to design a new surgery, to design a new computer-guided surgery. So this project of the upper provisional are the STL file that must be used with the DICOM file to design our surgery. And that's the project. It's very interesting because we can put all implant in bone and just one post-extractive, so we can realize an easy surgery guide that can be used with remaining teeth for better stability. We can realize the soft tissue thickness evaluation with the project, and that way we can choose the correct dimension of all the ailment, correct height of our OT equator abutment, and the correct position of our easy fix before the surgery. And we arrive the day of the surgery with our surgery guide and with our provisional, with realize taking care the tolerance to be cemented in mouth. So we realize a provisional with aesthetical parts in acrylic and metal parts that must be bonded in mouth on our easy fix abutment. So we don't pretend to realize a fixed rehabilitation just finished. We want something that can be easily cemented in mouth to have passive rehabilitation. And those are all the easy fix components we need. Those are new color, final color. So what you can use and what you can find today in the catalog, those are the elements with the correct color. And the day of the surgery, we have the provisional and our surgery guide. During the insertion of the implant, the important thing is just preserve the option to go with immediate loading. So the very important things is just to obtain a primer stability. And for that reason, you have to choose correct geometry of your implant, and you have to take care about the osteotomy. But that's not something that is related with easy fix system. It's something that you have to take care every time you do those kind of surgery. So maybe we can go faster with the surgery, because all guided computer guided surgery are a little bit boring. We go to the end of the surgery when we have put all our implant, and we insert the equator. As you can see, I prefer to use micromotor to insert my equator, because I can go in easy way in distal parts of the mouth, and we also can check the Newton force of insertion of my equator. For that reason, you can go with your finger, with a screwdriver to put your OT equator, but I prefer to realize that using micromotor. So at the end of the surgery and the extraction and the suture, that's the final results. We got our implant with the equator. And now it's time for the prosthetic time. And the interesting thing is that, why? Because when we deliver a provisional screwed on implant, we have to work to leave free all our implant. In this case, we have to leave free just one implant, the one who is involved in the use of the unlocking tool. All the other abutment can be treated as natural teeth. So, same way you reline a provisional on natural teeth without taking care of the screw. As you can see, we try in mouth the fitting of the provisional. We try with fit checker the absence of interference. And when we are happy about that, we reline the provisional same way we do on natural teeth. Just putting acrylic, waiting for the curing, and we have to take care just of one hole, because all the other one are retained by the cigar. So when it's free, this hole, we can move the screw, and with the unlocking tool, we remove our provisional. Very easy, very fast, faster respect all the other system of bonding in mouth of a provisional. After the finishing and the polishing of the provisional, we redeliver it like this, choosing the correct eggs of insertion, and we can fix it using one screw. Okay? In case of immediate loading, maybe you can use more screw, because those are our case. We are trying to study a systematic that can be shared. But that's very interesting, because we have done a different case like this, and all of these cases are working very, very well. Okay, so very easy how to remove it using the unlocking screw, who is the secret of this system. Okay, so I hope that everything was clear. That's the final RX of this case. Okay. But the important thing is, I hope that everything was clear. The importance of this prosthetic system is that nowadays it's possible to work maintaining all the benefit of cemented and screw retained rehabilitation in the same prosthetic project. Okay, you can work without screw and have the same benefit of cemented and screw retained rehabilitation. Thank you very much. I've finished my lecture. If you have some question, we are here. Spend a few minutes just for answering.